And we're pleased to welcome now the CEO of Covington County Hospital, Gregg Gibbes. Greg, good to see you. Thanks for coming on.
Hey, thanks for having me.
All right, so it's a big day here in Smith County. This is desperately needed in this area of the state, right?
Yeah, I mean, the closest ER for the people that live in this area is, it's a 35-minute drive. That's the closest one.
And what does that mean, Greg, just from a medical perspective, if you've got a long drive, a long travel distance to get some sort of emergency medical treatment? What are the risks of that?
It's really a magic window there to try to find emergency care. And for us being able to open up this emergency hospital, this emergency department, outpatient center here, is going to meet that need for those patients during that magic window of time.
And so is the idea, Greg, to get the patient stabilized and then, perhaps, if necessary, then to move them elsewhere?
Yeah, that's right. So in the Consolidated Appropriations Act back in 21, this is kind of where this whole idea started, was that they introduced a new hospital type called the Rural Emergency Hospital. And one of the conditions of participation for hospitals is you got to provide inpatient care. So this was the first hospital type that didn't require inpatient care.
I see.
And so we started thinking about this in 21 because, one of the struggles for rural hospitals is most of us are starving for business. And so you have a high cost center for that inpatient care.
I got you.
And, it's a large fixed cost area, and you don't have a lot of volume coming through the small hospitals. And for this mechanism to open up for the Rural Emergency Hospital back in 21, they finally finalized the rules and regulations in 23, which is when we started putting this deal together.
Okay. So I'm quite sure you've run the numbers. I mean, is this economically viable, or is this something you feel like?
Yeah, we believe it is.
Okay.
We believe it is. We've got some very conservative estimates on utilization. And, when I think about this whole project, there are several points of value for us. First and foremost, can we provide access to a population? But we can't do it without some sort of compensation for it.
Sure.
Right.
Sure.
There's this new rural emergency hospital payment structure provided that.
Okay.
Yeah. So, we believe it's going to be a great service, and we're looking forward to opening.
Is this a model we might expect to see across the state and maybe in other areas of the country?
I think there's 4 or 5 already in the state that have opened over the last 12 months.
Okay.
But there are consequences to the market where if you have hospitals that historically have admitted patients that switch to this rural emergency hospital, then you have less beds, and the larger hospitals in the state are already full. Typically on diversion, and so it's quite the situation where you've got small hospitals that are struggling for business and large hospitals that
kind of overwhelmed, don't have any, no excess capacity. I hear that around the Jackson area from my medical community friends all the time, that they're constantly running into that, almost like need an accordion, where you could kind of shrink it and expand it based on the market conditions.
Well, I'll tell you, so one of the things that we started doing with our collaborative of these hospitals, which is South Central Regional Medical Center in Laurel, Covington County Hospital, this McGee General Hospital, and Simpson General Hospital, is that we started doing what we call the reverse transfer, where is if a patient shows up to, let's say, South Central, this has happened on a number of occasions, and we're at capacity. We're already holding patients, perhaps waiting on a bed, and we have an opening at Covington or at McGee, and the patient that may already be from near there is willing to be admitted there. They'll take an admission to that hospital.
Okay.
And so it gets the patient into a care setting fashion. We think that Smith County Emergency Hospital here, we think that we're going to see a number of patients from this community that are seeking not only emergency care services, but Also, laboratory and imaging services here with the X-ray and CT and whatnot. The economic impact of this is significant. I mean, we think that we're probably going to be around that $15-20 million mark when we talk to University of Southern Miss, the Cochran Center, to do the study on it.
Okay.
And so job creation, economic impact, creating access to care, and providing a service that didn't exist. We think we've got a good recipe here.
Well, congratulations. Big day. I see folks getting ready for the dedication ceremony. So it's a big day for you now. Before we go, we got about 20 seconds. When will you actually be open and available?
Well, we have received notice from the Department of Health. As soon as they come in here and check the final box of their inspection, they've already been through once, said everything looks great. They've got one more round to make, perhaps sooner than later.
Gregg Gibbes,
Thanks for y'all coming and showing up today.
CEO of Covington County Hospital. Coming right back.